Hey everyone, it's Dr. Nicole Rochester, founder and CEO of Your GPS Doc. Welcome to another episode of Navigator Nuggets. I want to start by wishing all of you a very happy new year. We made it. We made it to 2021. Thank goodness. And I am very hopeful about what is in store for all of us. So, in this first episode of Navigator Nuggets for 2021, I wanted to bring you 3 tips that I believe every patient, every family caregiver, every individual should internalize related to your healthcare journey. Okay? So, tip number 1 is to choose your healthcare providers carefully. All right, I'm going to repeat that. Choose your healthcare providers carefully. Now, what do I mean by that? Many people just kind of pick a doctor by default. Maybe it's somebody that you've been seeing for a long time. Maybe it's somebody that your parents saw, even, or someone else in your family, and you just kind of stayed in that relationship. Maybe you just let your health insurance company assign your primary care doctor, or maybe you were limited to a very small selection of doctors based on the type of health insurance that you have. Maybe you just randomly chose one, eeny, meeny, miny, mo. And what happens is that many of us find ourselves with primary care doctors and even specialists who we don't really connect with and who don't really connect with us, who may not listen carefully to our concerns, who may dismiss us. And what I want you to know is that there are amazing doctors out here. There are amazing nurse practitioners out here. There are amazing PAs or physician assistants out here. And you should not just allow yourself to stay with a healthcare provider who you don't like or with whom you don't connect. Certainly not someone who doesn't seem to, care for you in the way that you prefer to be cared. So you're not stuck with that person. And I know that it can be a daunting task to, jump ship and find someone else, but I guarantee you it is worth it. It is worth it. We know that there are better outcomes when we connect with our healthcare providers, okay? So if you're with someone right now who you don't trust, who's never really taken the time to get to know you, you don't really feel comfortable with them, you don't open up and share with them, your deepest concerns, or maybe you even tell a few little lies and you don't actually share what you're really doing in terms of your diet or your exercise or whether or not you're taking your medications, that is not the doctor for you. And so you need to choose your healthcare providers carefully. And we spoke in another episode of Navigator Nuggets last year in 2020 about how to choose a good doctor. So I encourage you to go back and look at that episode of Navigator Nuggets. But briefly, you want to find somebody that connects with you, somebody that ascribes to the same philosophy. So as an example, if you're someone who really doesn't like taking a lot of medications, you're someone who prefers a more natural approach to your health care, then these are questions that you need to ask when you are looking for a healthcare provider. If you're that person, then you don't want to pick someone who really doesn't have any knowledge or background in natural medicine. And, generally, those of us who have been trained in traditional allopathic medicine, I hate to say it, but we're likely going to prescribe you something. Now, that doesn't mean that we don't start with diet and exercise and things of that nature, because we almost always do. But in all honesty, we are not as well versed as some other providers who may have more experience in that. And so that's what I mean when I say choose your healthcare providers carefully. Also, if you are someone who prefers a woman, or if you are someone who prefers a physician of a particular race or ethnicity or a particular age group, because that's who you connect with, that is okay. If you are someone who, prefers a doctor who's trained in at a particular institution, although I've warned you in previous episodes, that's not really the best way to choose your doctor. But if that is your preference, then you can use that information when searching. I think it's most important that you find a doctor who is qualified and with whom you connect. We know that you are more likely to follow through with that doctor's recommendations, and you are more likely to be healthy as a result of that, if you connect with the doctor, if you don't trust the doctor, if the doctor doesn't listen to you, if you don't feel that your concerns are adequately addressed when you go in for appointments, then A, you're probably not going to go into your appointments on a regular basis the way that you should. And B, you're maybe not going to follow through on the recommendations and advice that that doctor or that other healthcare provider gives you. So spend some time on this, the same way you spend time choosing cars, choosing vacation spots, choosing hairstylists, choosing makeup artists, choosing a tailor, or all these things that we sometimes invest a lot of time and energy in, but then we just open up a directory for a health insurance company and just pick a doctor. No, 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 no. So I encourage you in 2021 to choose your healthcare providers carefully. All right, that's my first tip. Tip number 2 is to be an active participant in your healthcare journey. If you have been following me, your GPS doc, all of the things, all of the social media that I create, the blog articles, anything at all related to your GPS doc brand, if you've been following me for any amount of time, you know that this is one of my central tenets, and that I literally believe that I was placed on this earth to empower and to educate patients and their family caregivers. And a big part of that is you being an active participant in your healthcare. Again, we have lots of data that shows that patients who are actively involved in their healthcare receive better care. They have better outcomes. So what do I mean when I say be an active participant? That means asking questions at your doctor's appointments. That means actively engaging in your appointments, not just sitting back and, blending into the background and just listening to what the doctor has to say, but that means being present, bringing your questions, formulating your questions ahead of time and writing them down so that you are prepared for the visit, not being shy or not being ashamed of having questions, speaking up if you don't understand what the doctor is telling you. So asking questions is a big part of being an active participant. It also means educating yourself. So if you have diabetes, if you have hypertension, if you have congestive heart failure or rheumatoid arthritis or lupus, or if you have any chronic medical condition, or if you're diagnosed with a new medical condition at the time of your appointment, it is up to you to get information about that condition. You need to know everything there is to know on, to a certain degree about your particular medical condition. You can read, you can ask your doctor for additional, pamphlets or other materials that you can read about those conditions. You can ask your doctor about reputable websites that you can visit to get more information about your condition. When you go for follow-up appointments or when you go to see a specialist, again, asking questions. All of this increases your knowledge of your own health condition. Yes, we physicians, we train for many, many years and we are the experts in terms of those conditions, but it's up to you to learn about them for yourself so that you can be an active participant in your healthcare journey, so that you understand more about why we're recommending the things that we're recommending. If a new medication is prescribed, I don't recommend that you just go pick it up. Engage in conversation with your doctor about what this medication is going to do. What are the potential side effects of this medication? What are the harms if you don't take it at all? What do you do if you forget to take it? Do you double up? Do you, skip a dose? Like, these are the kind of things that we need to do to be active participants in our healthcare. It also includes escalating concerns. So if you are in a hospital, as an example, and you feel like, you're not being taken care of properly, or you feel like a particular nurse or a particular employee or a particular physician is not providing you with the care that you deserve, knowing how to escalate those concerns. That's also a part of being an active participant in your healthcare. Sometimes, respectfully, we need to push back a little bit, especially if in your gut you feel that something is wrong. Also, being an active participant is using your voice. It's making sure that your concerns are heard. It's politely pushing back. It's stopping the doctor and saying, "Excuse me, I don't think you understood my concern." Or if they're jumping up to leave the room, it's saying, "Wait, could you wait just a minute? I have something else that I really want to say." Okay? It may be sending an email to your doctor or healthcare provider through the patient portal to clarify something. Maybe you've gotten home and maybe you realize that you don't really understand something that was discussed. Don't just wait 3 months later until that next appointment, or don't just make it up as you go along. You can send an email to your provider and say, hey, I'm looking over my notes, and that's another way, taking notes during the appointment. You want to be an active participant. Jot down some of the things that the provider is saying so that you don't forget that when you get home. And then, like I said, if you get home and you realize, I don't really get this, I don't really know what this meant, send an email, call back to the office, leave a message, okay? So again, that's tip number 2, be an active participant in your medical care, in your healthcare journey. And the last tip, tip number 3, kind of leads from that, and that is that you are the expert, okay? I really need you all to embrace that. We are the experts in terms of medical expertise. We are the experts when it comes to the practice of medicine. But you, and you alone, are the expert of your body and your medical diagnoses, okay? Nobody knows your body better than you. I don't care what the textbooks tell me about diabetes. If your experience with diabetes is different, you need to tell me that, okay? Many patients don't fit in the box. That's a term that we sometimes use in medicine. They didn't fit into the box. And when we say that, what we mean is that many patients don't necessarily show up the way the book tells us that they should show up. Their labs may not always look the way the books tell us that their labs should look, okay? Because we're each unique individuals. So, and the same token, you know your body better than us. If you're presenting for a doctor's appointment, or you're going to the emergency room, or you're going to an urgent care center, and you have concerns, you know in your gut that something is not right, and you explain your symptoms, and the doctor maybe runs a couple of tests and everything comes back normal, and then they say, okay, there's nothing wrong with you, but you know that whatever it is, this is not your normal. You need to speak up, and you need to remind that provider in the most polite but direct way possible that you are confident that there is something wrong, okay? Remember that you are the expert. Don't let anyone silence your voice. Don't let anyone silence your concerns. Again, doctors are, most of them are amazing. We want to help you. We want to solve your problem. We want you to be well. But as you all know from many of the other episodes of Navigator Nuggets and from your own experiences, the healthcare system in which physicians and other healthcare providers are forced to work is just not the way that it should be. And so due to time restraints and a lot of other things that we won't go into today, that doctor may not be able to be fully present. And so sometimes we need reminders from you. We need reminders that you know your body. We need reminders that you really are the expert. And that will allow you to partner with us so that we can absolutely provide you with the best care possible. Okay? So let me just go through those 3 tips. These are tips to make 2021 one of your best years when it comes to your healthcare. Tip number 1 is to choose your healthcare providers carefully. Tip number 2 is to be an active participant in your healthcare. And tip number 3 is to always remember that you are the expert. I hope that these tips have been helpful. If you're not already following me, if you're not already subscribed to the Your GPS Doc YouTube channel, I encourage you to go ahead and do that. I try to drop an episode of Navigator Nuggets every Monday evening. Also, feel free to follow me on social media. I'm on Facebook, Instagram, and Twitter, also at Your GPS Doc. Share this video, like this video, and be sure to meet me here again next Monday for another episode of Navigator Nuggets. Take care. Happy New Year. Continue to be safe. Continue to physically distance. Wear your mask properly over your nose, under your mouth. Wash your hands. All those things that we've been talking to you all about since February or March of this year. We are going to get through this. If you have questions about the coronavirus vaccine, I encourage you to watch last week's episode of Navigator Nuggets, where we did a live Q&A on Facebook, and that video is here on YouTube, and you can just hear some of the questions and hear my answers, and you can always feel free to reach out to me if you have additional questions. All right, you all, I hope that this was helpful. I will see you next week. Take care.